Hello and welcome. You're watching Good Morning India. I'm Gargi Rawat. Stay with us for all the news to start your day with. Coming up ahead, the Prime Minister to hold a review meeting on COVID as several states have announced restrictions over the holiday season. Also, the Prime Minister will be in his constituency in UP yet again. We'll get you all that and more. Let's take a look at the headlines we're tracking. Prime Minister Modi to hold a COVID review meeting today after the threat from the Omicron variant and a clamour for booster shots. Vaccinations in the country have dipped by 22% in December. Delhi Chief Minister Arvind Kejriwal will hold a review meeting on preparations for a possible third wave of coronavirus as Delhi has announced several restrictions. The ruling BJP in Karnataka will table the anti-conversion bill today for discussion. The law minister denies it will help vigilantes target Christians. The Karnataka Law Minister tells NDTV that the anti-conversion bill will not help vigilantes, says it will only punish those converting illegally. And we speak to Keanu Reeves and Carrie-Anne Moss on the new Matrix movie. Keanu Reeves says he's glad to share a new Matrix film and hopes people will like it. Our top story, the nationwide alert over Omicron and the approaching holiday season has left multiple states and union territories reporting particularly recent surge in coronavirus disease cases, concerned over the appropriate measures that need to be taken in order to cut the spread of the virus. So various measures have been announced, restrictions on large gatherings in Delhi, Karnataka and Maharashtra, where restrictions will stay till the new year. No salary for Punjab government staff without vaccine certificates, and in Haryana, only fully vaccinated people to be allowed in public places from the 1st of January. So let's just take a look at how state after state has announced curbs ahead of Christmas and New Year.
Another year, another muted year ending, thanks to the Covid-19 virus that does not seem to be in any hurry to leave. As Omicron cases steadily rise in the national capital, the Delhi government banned all gatherings to celebrate Christmas and New Year. All cultural events and other gatherings have been prohibited. Meanwhile, parts of NCR, like Gurugram, are still looking at the spirit of Christmas, with families and friends thronging to the malls. However, those in the hospitality and food business say they are already staring at cancellations due to Omicron.
We all are very scared. I know this is going to impact the business once again. I mean, this has been happening all year round, since last two lockdowns also. The business downtrend has already started. There have been a lot of cancellations. People have actually cancelled their travel plans also already.
Delhi has banned public gatherings for Christmas and New Year's, keeping in mind the threat posed by the new variant Omicron. But in the rest parts of the national capital region, such as here in Gurgaon, public spaces are decked up in the spirit of Christmas and New Year's, but authorities say that they will be very careful with the public adhering to COVID protocols.
In Karnataka, large gatherings are banned from December the 30th to January the 2nd. In Bengaluru, for the second year running, the usual crowd gatherings on Mahatma Gandhi Road and Brigade Road of the Central Business District has been banned. No big events are allowed to see in the new year in hotels or in housing colonies. No events with DJs, and clubs and restaurants can only operate with 50% capacity with fully vaccinated staff. Christmas is not really affected, at least for now, with mass being allowed and gatherings in churches being permitted as long as COVID protocols are followed. In Mumbai, ahead of Christmas and New Year festivities under the Omicron cloud, the BMC ordered that prior approval from the local disaster management authority is needed for any gathering, even in an open space, for 200 people or more, until further orders. Until last weekend, the permission was necessary only for gatherings with more than 1,000 people.
New Year celebrations will of course looks like to be in low key. The 144 recent clampdown, although it doesn't affect the hotel and restaurant operations, is kind of leaving a sense of doubt and in the minds of the people as to what is going to happen. But let me tell you, the industry is fully geared up and all protocols are being fully followed in every restaurant and hotel.
With officials calling for strict and prompt action before cases hit critical thresholds, more curbs cannot be ruled out. With Pooja Bharadwaj and Shonakshi Chakravarti, Maya Sharma for NDTV.
Now, Prime Minister Narendra Modi will review the coronavirus situation in the country in the wake of the Omicron spread. The new variant of SARS-CoV-2 virus has affected more than 231 people in the country till now. Those are the cases that are known, and experts fear an Omicron-triggered third wave.
Behind these obscured doors and windows are some of Delhi's Omicron patients. These measures have been taken to protect their privacy. Access is strictly restricted to healthcare workers in PPE suits.
We have got approximately 3 or 4 patients till now in last 2 to 3 days from the home isolation facility itself. So that time it was a different story. It was only from airport. But now we even get calls from the home isolation centers, that we need the patient to be admitted to your facility.
Delhi has just reported 125 new cases of COVID, the highest in over 6 months, and the third time there have been over 100 cases in 4 days. Test positivity rate in Delhi is still only 0.2%, although it has the highest number of confirmed Omicron cases. But doctors warn that this could be the beginning of a rapid spread.
The absolute number of individuals in India who are still vulnerable, either because they don't have adequate immunity or because they are elderly and have high-risk medical conditions and haven't been boosted, that absolute number of individuals is quite high. If Omicron variant causes milder disease, the sheer number of infections because of increased transmissibility can overload the system.
The centre has called for emergency action if a district's positivity rate crosses 10%. As per latest government data, only 2 districts in Mizoram meet this threshold. The Health Ministry has called for emergency action even before the threshold is met. There are 22 districts in 7 states that are reporting test positivity between 5 and 10%. In Assam, Kerala, Manipur, Mizoram, Rajasthan, Sikkim and West Bengal.
As Omicron cases are spiralling and so is the anxiety surrounding a third wave, the Prime Minister is expected to chair a high-level meeting tomorrow to discuss the threat and preparedness for this variant of concern. With Pooja Arya, Meher Pandey, NDTV.
Now, the case positivity rate in national capital Delhi has once again started to rise, and in view of this, Chief Minister Arvind Kejriwal will be conducting a review meeting today to assess the preparedness and management in view of the Omicron variant. The meeting has been convened at the Secretariat this morning and will be attended by concerned ministers and officials. A review of preparations for home isolation, including hospital beds, oxygen and medicines, will be done. Now, amid the Omicron threat and raging debate over boosters, the vaccination rates in India is down 22%. But there's some good news, like Gurugram has fully vaccinated 100% of its population. In fact, the daily rate is about 58 lakh vaccinations, which means at the current rate, only 42% of the total population would be vaccinated by the year end.
A milestone in India's vaccination program. Gurugram has fully vaccinated all the eligible population, that is above the age of 18, 10 years ahead of the year-end deadline. It's the first district in all of India to do so.
We were the pioneer in the drive-through. We were the pioneer in the third gender vaccination, especially able children and auto drivers and other high-risk groups and sex workers, etc. And we have taken it to societies, industries.
Health officials say that they worked hard to overcome vaccine hesitancy.
उस टाइम तो काफ़ी डर था, सभी लोगों को डर था, बट धीरे धीरे लोगों को समझ में आया कि 1 महीने बाद, 2 महीने बाद फिर लोगों ने घर से बाहर निकलना शुरू करा और एक टाइम ऐसा आया कि जिसमें हम लोग 2-2 हजार लोगों को यहाँ पे कवर कर रहे थे एक दिन में.
Gurgaon, the Millennium City, has been able to achieve the target of vaccinating its eligible population with both doses of the vaccine, making it the first district officially in the state of Haryana to achieve this feat. Certainly a milestone moment in India's vaccination program.
However, at the current rate, Haryana will fully vaccinate only 46% of the total population by December 2021. And all India, the rate of daily vaccination has actually fallen 22% from 1st December to now. In fact, the daily rate is about 50 lakh vaccinations, which means that at the current rate, only 42% of the total population will be vaccinated by the end of the year. With Sonakshi Chakravarti in Gurugram, Bureau Report, NDTV.
Now, former Samajwadi Party MP Dimple Yadav has tested positive for COVID. In a tweet, the wife of former UP Chief Minister Akhilesh Yadav said she's fully vaccinated, but she is in self-isolation now. She says, I'm fully vaccinated and not showing any symptoms. For the safety of myself and others, I have isolated. Akhilesh Yadav has been campaigning across UP for the assembly elections. He's also likely to get himself tested. He hasn't been vaccinated so far. He and Rashtriya Lokdal leader Jayant Chaudhary are scheduled to address a joint rally in Aligarh today. Well, with that, time for us to slip into a short break. Coming up on the other side, the Prime Minister is going to be in Uttar Pradesh yet again today. We'll get you the details. Welcome back. Prime Minister Narendra Modi will be in his constituency Varanasi in UP again today to launch multiple development initiatives and schemes worth 2,095 crore. Now, the Prime Minister has been in UP several times in recent days. He's also been visiting Varanasi ahead of the assembly elections in the state. In fact, in the last 37 days, there have been 10 visits that Prime Minister has made to UP. The BJP is aiming to return to power in the state under the leadership of Yogi Adityanath, and the Election Commission is expected to announce the schedule of UP assembly elections in the first week of January. Now, a special report raids this weekend on the aides of Akhilesh Yadav. The BJP's main rival in poll-bound UP has once again turned the spotlight on the use of central agencies to target the Modi government's political opponents. Now, a 3-month-long NDTV investigation has found how action by central agencies against the BJP government's rivals and critics has witnessed a massive spike since the BJP-led government came to power in 2014. Since 2014, central agencies have targeted a whopping 570 of the government's political rivals and critics, 340% jump compared to the Congress-led UPA2. The NDTV analysis capturing this explosive surge was compiled using public domain information of reported instances of action taken by central agencies, including the CBI, the Enforcement Directorate and Income Tax. NDTV's Mariam Alvi has more.
Since May 2014, when the Modi government first came into power, 570 government critics have faced some sort of coercive action. Of the 570, close to 400 or 70% are BJP's political rivals, their family members or their aides and associates. This is a massive increase compared to similar action under the UPA2 government. This is a jump of 340% compared to similar action under the UPA2 government. And it's not just politicians and their relatives that are there on the list. We have media who are seen as independent or critical of the government being targeted, like the recently Dainik Bhaskar and Bharat Samachar, who had covered the devastation of the second wave quite extensively. Activists like Sudha Bharadwaj and others in the Bhima Koregaon case. Critics like Tapsi Pannu, Anurag Kashyap also on the list. And even bureaucrats who have questioned the government were also targeted. Let's not forget the tax cases against Election Commissioner Ashok Lavasa's family members after he had disagreed with the clean chits given to Modi and Shah during the 2019 elections. If we can pull up those graphics on screen, we can see that right now. Action against BJP's rivals, we have 570 individuals or organizations. And on the other side, action against BJP's own members and their allies is a measly 39. And so essentially, almost 15 of the opposition are targeted for every one of their own.
Right. So that's a big shift. You also looked at just 570 when it comes to rivals and just 39 when it comes to quote unquote the home team. And you also compared this to similar actions, because obviously all governments do this, similar actions taken under the UPA too.
Exactly, like you said, all governments do this and this is not new, but the scale at which it is being done, that is what is staggering here. Under the Modi government, since May 2014, we saw 570 government critics face some sort of action. That is an average of about 75 a year. Under UPA 2, between 2009 and 2014, there were action against 85 such critics. That's an average of about 17 a year, Vasu, and that's a jump of 340%.
Okay, that's a very important number to remember, that again, it's not as if government critics and rivals haven't been raided or targeted in the past by governments, but it's the huge surge which is of note and which is concerning, 340%. Let's just also put up, Mariam, another graphic we have which just gives you an idea of who out of the political parties have been targeted the most. And let's go through those numbers now. And this is virtually every political party in India, non-BJP party, has a case against it. Congress, Mariam, is leading the pack, not surprisingly.
Exactly. Like you said, virtually everybody from the Abdullahs and Muftis in Jammu and Kashmir to M.K. Stallin's family and others of the DMK in Tamil Nadu, virtually every political party in the opposition is on our list. And at the top of that list is Congress, with 75 of their members targeted, including an IT notice to the Congress party itself. Now, this could be by virtue of being the largest opposition party. But next on the list is the other most vocal opposition right now in India, the TMC. 36 of their members were targeted, including investigations by the Enforcement Directorate, CBI and the IT department into funds received by the party.
So you've got Congress 75, TMC 36, Aam Aadmi Party 18, NC National Conference 14, PDP 12, TDP 12, DMK 11, NCP 8 cases, RJD 8 cases, BJD, BSP, JDS, Shiv Sena, SP, Independence, YSRCP, CPIM, AIADMK, IUML. So, and the list goes on and on. If it goes all the way down, the Akalis, AMMK, Raijor Party of Assam, Janasena. So, it really is going down to almost every single political party. And Mariam, now what we've done is we've kind of visualized a gallery of all those that have been targeted by the BJP or under the BJP's watch by central agencies. And this is now all the politicians that are coming up on the screen. These are, by the way, not even perhaps, Mariam, all of them.
Exactly, Vasu. This is just a sampling of the politicians that have been targeted. There are far more. There are in fact 257 politicians to be exact that have been targeted by the Modi government. This is just a sample of that.
Right. But just looking at that, let's stay with that for a second, because just looking at that, you get a sense of the scale of the numbers of those who've been targeted. You'll see obviously familiar faces there, which includes Congress leaders like Sonia Gandhi, like Rahul Gandhi, who face charges. Sharad Pawar is there, Mayawati is there. But then you have also a whole host of other political leaders, perhaps some of whom are not that prominent. But again, it gives you the size and the scope. And Mariam, let's now look at the others who've also been targeted, which, as you mentioned, includes journalists, it includes activists, it includes bureaucrats, it also includes even film stars who've asked or raised uncomfortable questions like Taapsee Pannu and so on.
Exactly, Vasu. So this again is not a complete list of everybody who has been targeted. There are many more. But this is just a sample. You can see you have Amnesty there, you have News Minute, Quint, media organizations like NewsClick, etc. Dainik Bhaskar. You have activists like the climate activist Disha Ravi is on there. We have student activists like Kanhaiya Kumar, who was a student leader then, Shaila Rashid and others, and other activists like Sudha Bhardwaj, etc. These are just a sample of the type of leaders and activists that they've gone up against, including some of the farm leaders that were in talks with the government about calling a truce. They were also targeted in the list. There is a pattern and there is a design. If we look at Tamil Nadu, In 2021, right before the state was going to polls, you saw multiple DMK leaders being targeted, including tax raids on MK Stallin's daughter and son-in-law just 4 days before the state polls. In West Bengal, again before the 2021 state polls, agency action was taken against at least 14 TMC politicians, relatives and associates. This was before and during the state polls of 2021. In Rajasthan, during the 2020 political crisis when Sachin Pilot was attempting a coup of sorts, we saw action against at least 6 Congress politicians and aides, including the questioning of Ashok Gehlot's son, brother and OSD. In Karnataka in 2019, in the run-up to the Lok Sabha elections and also the political crisis that the government of the time was facing, and the government eventually collapsed in July 2019, at that time, at least 14 JDS and Congress politicians, relatives and associates were targeted. In Gujarat, ahead of the Rajya Sabha elections in 2017, tax raids happened on the Karnataka resort where Congress's 42 MLAs were being sheltered.
Welcome back. After introducing the anti-conversion bill with a controversy facing stiff opposition from the Congress and JDS, the ruling BJP in Karnataka will be bringing the bill today for discussion. NDTV Shrija spoke to Madhuswamy, the Minister for Law in the state, and asked whether the government's intent was to victimize the Christian community. He says the bill is to protect all religions from illegal conversions, while suggesting they do have data to support their claim.
If you're going through the bill, there are certain points which actually tries and attacking, victimizing the minority community. Is this a form of the BJP government to attack the Christian community?
I'm really sorry to tell you, the bill is framed to protect all the religions, not major community or minor community. If anybody wants to convert to other religion, it has to be voluntary. He has to give an application before district collector and he can get himself converted. If any forcible conversion is there, either from any community, Christian to Hindu, Hindu to Christian, Muslim to Hindu or Christian, if it is illegal, that is punishable.
Okay. On what basis? What was the basis behind bringing this particular bill? Have you all done your research? Have you all gone around to find out how many cases registered? Anything data do you have?
We have a lot of data. The bill itself says it is for the public order. We are bringing the bill because all these provisions are envisaged in the Constitution itself. Whereas there is no punishment clause. They say it is an offence. They say it's an illegal activity.
Isn't it a harsh penalty?
No, it depends on the degree of offence.
Okay.
We have done that. Okay. If you voluntarily go and convert yourself, there is no punishment. You are free to convert. But what we require is you have to give in an application, form number 1 to DC. If there is no force, there is no allurement, you can convert yourself, no problem.
So, but don't you think that you all should have also taken the communities in confidence before coming up with the bill?
Which community?
Whether it is your minority community I'm talking about.
See, it is a wrong assumption. We are not targeting any community here. Everyone is safe. Even there are conversion from Muslim to Christian to some other caste. Nowadays, all these Hindu Sangatnas, they are converting Christians to Hindu. So we are not targeting any religion in this bill. Yes, constitutional provision 25 to 20, Article 25 to 28 is there. Under that, whatever is illegal, we are going to punish it under law.
I did go through the bill. I went through the entire bill. It does talk about the burden of proof lies on the converter, yes. Right? Now the question is, don't you think this gives a free hand basically to fringe elements? Anybody can go ahead and complain, make a complaint.
No, we have not made that. Not anybody. His relatives or his blood kin and kids can complain, his colleagues can complain.
What if he can be influenced by other fringe elements?
No, we are not entertaining those complaints. No, not anybody is not there. There is a word, his colleague. Why we have added that is, if somebody who was entitled for some benefit under scheduled caste or some reservation category, if he converts to some other religion, he will lose his benefit. From on that day, he is not entitled for that benefit. If he keeps on taking the benefit, his colleagues can complain. That is the only idea why we have put colleagues in the list. He may be in government service. If he take advantage of his earlier religion for promotion and all this, even after conversion, his colleagues have every right to say.
So you have a data in hand to say that there is illegal conversion happening?
Yes, certainly.
Now, the Prime Minister will be reviewing the coronavirus situation in the country in the wake of the Omicron spread. The new variant of the virus has affected more than 231 people in the country, and experts fear an Omicron-triggered third wave next year.
Behind these obscured doors and windows are some of Delhi's Omicron patients. These measures have been taken to protect their privacy. Access is strictly restricted to healthcare workers in PPE suits.
We have got approximately 3 or 4 patients till now in last 2 to 3 days from the home isolation facility itself. So that time it was a different story. It was only from airport. But now we even get calls from the home isolation centers, that we need the patient to be admitted to your facility.
Delhi has just reported 125 new cases of COVID, the highest in over 6 months. And the third time there have been over 100 cases in 4 days. Test positivity rate in Delhi is still only 0.2%, although it has the highest number of confirmed Omicron cases. But doctors warn that this could be the beginning of a rapid spread.
The absolute number of individuals in India who are still vulnerable, either because they don't have adequate immunity or because they are elderly and have high-risk medical conditions and haven't been boosted, that absolute number of individuals is quite high. If Omicron variant causes milder disease, the sheer number of infections because of increased transmissibility can overload the system.
The centre has called for emergency action if a district's positivity rate crosses 10%. As per latest government data, only 2 districts in Mizoram meet this threshold. The Health Ministry has called for emergency action even before the threshold is met. There are 22 districts in 7 states that are reporting test positivity between 5 and 10%. In Assam, Kerala, Manipur, Mizoram, Rajasthan, Sikkim and West Bengal. As Omicron cases are spiralling and so is the anxiety surrounding a third wave, the Prime Minister is expected to chair a high-level meeting tomorrow to discuss the threat and preparedness for this variant of concern. With Pooja Arya, Meher Pandey, NDTV.
Now, what is worrying is the United Kingdom has reported more than 1 lakh daily cases. This is as Omicron has spread through the country, and it's the highest daily rise in cases since the pandemic began. 140 deaths were also reported in 24 hours. Cases are up more than 50% in a week, while deaths are down 2% in 1 week. So some solace there. And if we speak of South Africa, that was the first to identify this variant. Well, it does seem the worst is over for South Africa. Experts say South Africa has passed the peak of the 4th wave. Rishika gets us a roundup.
The big headline is, could South Africa have potentially passed the peak of the 4th wave? Now, there has been a significant drop in the numbers. There are 8,500 cases in the last 24 hours, as opposed to the peak, which was around 37,000 cases being reported in around the 7th of December. Now, experts in South Africa have said that the severity of infections and hospitalizations, thankfully, so far continue to remain low. The positivity rate is dropping across South Africa. Even the provinces like Gauteng, which were reporting very high cases, they are declining. Other provinces are peaking or are also starting to decline. So that's the good news, or the glimmer of hope coming in towards the end of 2021 from South Africa. Meanwhile, the big debate around booster shots. Now, the WHO chief has said that booster shots is a scandal and you need to focus on vaccinating everyone first instead of boosters for a select few. Well, the WHO Europe regional director has spoken a different language, advocating booster shots for all those in Europe. Meanwhile, a worrying study has come to light in the Lancet, which essentially goes on to show that the AstraZeneca vaccine, which is Covishield here in India, and over 80% of Indians, remember, have been vaccinated with Covishield, the protection from this vaccine lasts for only about 3 months after you've been given both doses of the vaccines. Now, these findings are significant because the data set runs into millions. Brazil and Scotland are the 2 places where the study was conducted. 2 million people in Scotland and 42 million people in Brazil who were vaccinated with Covishield have been studied. Speaking of boosters, Israel is now the first country in the world to have offered a fourth booster dose to all those above the age of 60 as well as their healthcare workers. And COVID restrictions, of course, the big headline here in India. But in the US president has said that all vaccinated people can in fact go ahead and celebrate Christmas. The UK Prime Minister also, despite the surge in cases, has said no tougher measures before Christmas will be implemented. And of course, the big international headline in terms of Bill Gates, who took to Twitter in a series of tweets and has voiced, I think, everyone's fears and concerns about Omicron, where he said that we could potentially be entering the worst phase of the pandemic so far. He's also talked about the historic spread and highlighted just how little we know about just how sick Omicron makes us.
Hi, Keanu. Hi, Kerry. This is such a pleasure to be talking to both of you on behalf of millions of fans in India and overseas.
Thank you.
Hi. My first question is to both of you. Kerry, you can tell me what's the same. Keanu, you can tell me what's different.
I think that everything felt different in a way. What did feel the same, okay, I'll go back to my question, the same,
right,
was the feeling I have working with Keanu.
Right.
Felt so familiar, and it was just wonderful to do that, and it felt so familiar to me. It was as if no time had passed.
Right. And Keanu, what has changed?
I would say the way that our director directed.
Right.
Lana Wachowski really had an evolution in the way that she directed, in the way that she created the film. She used to kind of be behind the monitor and, had a certain kind of perfectionism and control. And when we were making the film, she was like in front of the monitor and kind of embraced and leaned into spontaneity and in the moment. And so that was very, very different.
Brilliant. Kerry, somewhere did you know that this is a call you're going to get someday or the other, sooner or later?
Did I know that I would get this call to come back?
Yeah.
No, I never thought I would get a call to go back. I'd heard people talking about it, or people would ask me, but I was 100%, absolutely no way will that ever happen. It was a complete and total shock for me.
Right. Keanu, what about you? You knew, you're the internet's darling. People still talk about Matrix, share memes. Do you get to see those?
Yeah, once in a while, friends will show me some wacky memes. And yes, I mean, I never thought that we wouldn't share another story from the Matrix, but I'm really glad that we have and that we are. And yeah, I hope people like it.
Right. And, Kerry, do you get to be in touch? You all live in the same city, if I'm not wrong. Do you all run into each other sometimes?
Not really.
No.
No, we haven't. No.
We have to make that happen when it happens.
Right. And I watched this one, the magic is still there. What is this, what is it about these two characters that we all love and relate to it? Even in 2021, we are talking about it.
Oh, well, that's kind. Thank you. And they love each other. There's like a purity, there's like a strength, there's
partnership.
They're respect.
Mm-hmm.
Right.
They're like, and they're, they kind of want to do it.
Right. Kerry, everybody wants a bit of the millennial spy. Do you think this is Matrix for the millennials, for the new generation?
Yes. You ask me?
Yes.
Oh, I don't know. I am so bad at I don't even try to imagine what the people watching the movie will experience or how it will impact them, because my brain doesn't work that way. I know that I have no idea. So it'll be really interesting to see. I'm excited about that. Curious about that, I think, more than excited. Curious about that.
Right. And Keanu, how do you go back to the same world on the first day of the sets? Do you watch the earlier movies as well?
I did, actually. Yeah, okay. I did. Before we started filming, Yeah, I watched the trilogy. Did you watch the trilogy?
I did.
Yeah.
Oh, you both did? Okay, great, fantastic. This is a magic that will continue to stay with so many people. What do you want to tell your fans before I wrap this?
If you go to see the film, I hope you enjoy it. We had an amazing experience making it, and I love the film, and hopefully you will too.
Thank you, thank you.
Well, news now from Kerala, where 9 more Omicron cases have been reported, taking the total number of new cases of the variant in the state to 24. Let's go across to Sneha now for more. Sneha, give us the details.
Well, Gargi, total cases 24 for Omicron in Kerala. 9 new cases have been reported last evening. And of this, 6 are those who returned to Ernakulam and 3 to Thiruvananthapuram. All of them are foreign returnees. But what is perhaps a sense of respite is that neither of these cases have any primary contacts as such beyond their immediate family in certain cases, or because they were in isolation once they returned, and most of them even tested positive for COVID at the airport, and eventually, of course, the genome sequencing was done. So these returnees largely are from UK, Tanzania, Ghana, Ireland, Nigeria. So total cases now at 24. The test positivity rate in Kerala for COVID in general, though, is on the decline. It's among the higher numbers across India. The daily cases are around also on the higher side. However, there's been a drastic dip if you look at the cases within Kerala in a span of over the last 2 months. It's the Christmas season, it's the New Year, so the Health Minister has again said that you have to be cautious, but there are no new advisories per se about any restrictions for this festive season. Gargi, back to you.
All right, Sneha, thanks so much for joining us with those details. And let's take a look now at Telangana, where 38 cases of Omicron have been detected so far, and they're up by 14 in a single day. 12 passengers from other than at-risk countries. Let's go across to Uma for more. Uma, give us details of fresh cases being reported.
Yes, indeed. The jump by 14 just in one single day in Telangana certainly has caused some concern, because out of 24 out of the 9,800 odd immigrants, foreign travelers who had come into the Rajiv Gandhi International Airport, 63 of them, 9,300 odd were tested in fact, and 63 of them had tested positive, of whom we are talking about 37 people who have tested positive for the Omicron variant. What is worrying, I would say, Gargi, is that out of these, 31 of them are people who have come from not at-risk countries, which means only 2% of that population was in fact done, random sampling was done, out of which we are talking about 37 of them testing positive. 6 are people from the at-risk countries which are being screened 100%, and one of them was a case of local transmission, where in fact an oncologist who was treating a cancer patient who had come in from Africa and who subsequently tested Omicron positive, he has also now tested positive, and therefore whoever are the patients since the 12th of December who this doctor has been seeing ever since this other patient was, the primary patient was adjudged or found as tested to be Omicron variant positive. Subsequently, all those contacts are being traced. The second significant factor is that till now we are talking about all of them being limited to the GHMC area, because all of them were coming in from the Rajiv Gandhi International Airport. But out of those 38 cases, one of them had in fact travelled to Sirsila, and therefore Sirsila district is now having one contact of one person who is Omicron positive, and therefore all the contacts in that area now are going to be screened, and that could lead to a multiplier effect, as we are seeing that in the case of the Omicron variant, the transmissibility is very, very high. We are in fact outside a vaccination center, but it has not yet begun because 10:30 is the time when the vaccines begin, and it's talking about the first dose Covishield and the second dose after 98 days. We are being told that vaccinations will only start at 10:30 a.m. What I must point out is that in Telangana, the target was that by the month end they would do 100% at least for the first dose, and as of now, reassuringly, yes, they have completed 98% coverage of the first dose, but the second dose still is lagging, with only about 61% having taken the second dose, another 40% short, for which special drives were conducted. So even as many of the doctors who we spoke to in Hyderabad said that yes, booster dose may be something that's very useful at this stage to stop serious cases or people getting hospitalized, even though yes, there are some reports, of course, which we are also talking about, where we are saying that Omicron is turning out to be a more milder case. But they are pointing out that the primary 2 doses, till they are not giving, perhaps the booster dose the government should not go ahead with, because it is a more privileged who may end up cornering those doses. But of course, everyone pointing out that the more vulnerable groups, the comorbid groups, the elderly, and of course the health workers, the frontline workers ought to get their booster doses. But Telangana, for the Christmas and for New Year, has not imposed any guidelines, any fresh guidelines or advisory, which means that only the standard protocols that we are talking about, whether it is social distancing or masking, only that is recommended. In fact, Hyderabad Police Commissioners, has appealed to all the business establishments, including the hotels, pubs, all those places, to follow protocols and ensure that whoever is coming in also follows protocols. But yes, there is no limit on the numbers that can attend Christmas parties or New Year get-togethers or even marriage parties, because this does happen to be a marriage season as well. And if we in fact pan around and show you, yes, at least that group seems to be quite masked, but I can see some eateries the other side, which in fact are without masks and which perhaps cannot be helped either. Back to you, Gargi.
Welcome back. Well, let's now talk about the Omicron variant and what it means for the country. The new variant has affected more than 231 people in the country so far. That's the cases that we know of. And experts fear an Omicron-triggered third wave. Also, a Lancet study has found that AstraZeneca vaccine immunity wanes after 3 months. Remember, that is Covishield vaccine in India. And 3 studies have now found that the Omicron variant is milder than Delta. Well, to talk about all this, we're now joined by Dr. Yatin Mehta, Chairman, Vedanta Institute of Critical Care, Dr. Ravindra Mehta, Chief of Pulmonology and Critical Care, Apollo Hospitals, Bengaluru, and Dr. Vishal Rao, Member of Expert Committee, COVID Task Force. Thank you so much, doctors, for joining us. And Dr. Yatin Mehta, first to you, it seems more and more clear that we are going to see a surge in cases, by next year at some point, once Omicron takes grip and, we have community spread of Omicron. Is there any sort of solace or reassurance in the fact that, more and more studies seem to suggest that it's milder than Delta?
See, although WHO has still said that the evidence is not sufficient at the moment, but there are one Scottish and one English study have come out, which are not yet published, but they seem to indicate that severity is less, but transmissibility is about 5 times more. Also, the South Africa, the peak which happened, seems to be subsiding. Again, it means the same thing. The impression is that it is less severe, but more transmissible. And but the caveat is that even if it is less severe, once you are hospitalized, then the severity is the same as Delta or any other variant. So one should not be complacent. There is some, light at the end of the tunnel, that it may be less bad than the other variants, but we have to continue with what we have been doing and be prepared for the worst.
All right, Dr. Ravindra Mehta, what is your view? And, states have announced various measures in Bengaluru. In fact, there are no big parties allowed for New Year's, and, those big events have to be cancelled. So states are doing what they can to, restrict or put off any sort of spread of this variant.
Right. So what's happening is that every state has their own advisory committees. We have a technical advisory committee here which has looked at the writing on the wall. And I think 2-3 data points have come in. One is the experience with Delta. Everybody felt that we were caught napping. We've not moved fast enough. Secondly, the Omicron threat which came as it's got more mutations than ever seen before, so which worried us. The tempering factor, it doesn't seem to be so bad, but that is also variable. Every second day we're getting different information. So I think everyone's taking a right-sided stance, go full Monty on the precautions. Just hold everything because this is the way it is. It is X today and 500X tomorrow. That has been the experience in the world. So it's very rational to do that from a logistic, government and healthcare point of view. Time will tell us what is there. Inwardly, we're a little more reassured that it doesn't look as bad, but we don't know the final word on this, and we're very, very worried with our past experiences.
No, absolutely. And given our absolute numbers, Dr. Vishal Rao, given the spread of Omicron in different parts of the world, there's been a clamor for booster doses of the vaccine. The WHO, yesterday you had their expert in Europe saying boost, boost, boost as the advice. Now you have the WHO head saying that, you can't boost your way out of the pandemic. You have to have a strategy and it has to be, aimed at the most vulnerable, the booster doses. But at the same time, priority should be to provide vaccine to countries that don't have them.
Sure. And I think that's a very valid debate today. And as we are in touch with many of the global experts from the WHO's team also, what seems to be echoing is, on one side, there is enough of compelling evidence both from the USA CDC as well as the UK NHS to show that a booster dose seems to be imminent if it's more than 6 months past your thing. In fact, some countries have done it post 3 months of your second dose. And there is enough of evidence to show that this will remind your immune system, your memory T cells to kind of prepare for the new variants to come. So there seems to be an obvious race between the vaccination and the new variants at this juncture. But at the same time, there are many countries of the world, like we were talking some time back to the Africa team, and there were countries that said that they've just hardly completed 3% of the vaccination. So at this juncture, when your entire ecosystem for the world, the virus is a global village, you see a new variant can crop up from any part of the world, like Africa or any other place where the vaccination is very low. So the debate continues on 3 for me and none for you. So I think WHO is repeatedly requesting countries to look at understanding and putting a moratorium on third doses until each country completes 10% of the vaccination at least. And this would be important for us to kind of secure the entire globe completely. While the frontline workers definitely need to be prioritized for a third dose, considering the fact that there is enough of compelling evidence to show that a booster may be required.
No, especially after this Lancet study that talks about how Covishield wanes after 3 months, the immunity wanes, and all of you frontline workers, all the elderly people in the country have had their vaccinations early this year. So already immunity would be low in face of this new variant, isn't it?
Absolutely. And I think that's why it would be very crucial that you look at the UK guidelines, the USA guidelines, the European guidelines, all the published studies. Israel was one of the first to publish its data in Lancet talking about it. So no matter if it's an mRNA or any other inactivated vaccines, overall consensus among immunologists globally, we work closely with the Emory Center and we've been discussing with their heads there and talking to them. All of them seem to be in consensus to say that no matter which type of vaccine, 6 months and your immune system will require a reminder to continue its preparation for the new variants.
Right. So, Dr. Yatin Mehta, your view on this, given what we do know and given that now it does seem inevitable that we are going to see a surge in cases, by next year is what many are saying, or what is your estimate on that? But at the same time, there needs to be a plan to give a booster dose to at least frontline workers and the elderly.
I 100% agree with that. There is absolutely no question. There is enough evidence that the immunity wanes after 6 months. There is enough evidence that the vaccine at the moment remains the best protection for us. And therefore, I think I see really they are being the advisory committees or whatever are being pretty cussed about it. I think there is no need to be stubborn. You have to be flexible. You look at the way the NEJ and Lancet papers and JAMA papers have been published in recent times. They have expedited their peer review process. Similarly, we have to be ready for the pandemic, and this is given that a booster will give you certain degree of protection, immunity wanes. That is enough evidence for us to have a public health issue, and healthcare workers and immunocompromised elderly people must be given a booster dose.
Dr. Ravindra Mehta, what about children? You know, so far there was a lot of talk in August, September saying that, you know, by October perhaps we'll have vaccines for children, at least children who are more susceptible, who are immune compromised. But so far, you know, it seems that everything has gone, you know, silent on that front. We're also not hearing about new vaccines being introduced into our kitty. We don't have mRNA vaccines either.
So children is a big problem, and that is one of the reasons we're saying this epidemic or this pandemic will not end that fast, because there's always going to be some targets left over there. The good news is that children seem to have an immune system which is not actually going through the big onslaught of COVID despite getting infection, and all those fears initially which were talked about have not been so horrendous. The concerning part is that children cohort the most. They're going to be playing, they're going to need to go back to schools, they're basically a part of functions, gatherings, and then they go back to their homes and they perpetuate the cycle. Children vaccines have been a big push, but as all pediatric drug development, it is the slowest to happen. We have candidates in our country, but the candidates have not made it to the ground level. We have Zydus we're talking about for a long time, still not seen penetration. Covaxin theoretically out there, but practically difficult to implement. The only imprint of pediatric vaccines we have is mRNA, and so maybe it's time to think out of the box. Either expedite the local stuff so as to give assurance of safety and implementation, or get the mRNA somehow so that we can go one level higher. A lot of things need to move faster. I think we're going through COVID fatigue at all levels, global level, at a country level, at an individual level. There needs to be think tanks who continuously think of this so as to look far beyond towards how to take this wholesomely to an end and not just react to situations which are happening so often in COVID.
Right. Dr. Vishal Rao, are you hearing anything on this front? The Prime Minister is going to hold a review meeting today. Do you think, soon we're going to hear about more vaccines or vaccines for children?
Yeah, and I think this is going to be, like Dr. Ravindra Mehta emphasized, this is going to be an important priority. And considering the fact that I want to again take us back to some time back in December 2020, when we first picked up the Delta through genomic surveillance. And by March, if you look at Karnataka, it was at 0.5 positivity rate. By end of March, it was at 5% nearly positivity rate. And by end of April, it was at 25% positivity rate, going up to every day about 50,000 new cases. Now, if you look at studies and trends from South Africa and that what they have released, higher transmission, higher virulence, and greater amount of vaccine escape. The virulence part, the Lancet team and many global experts across have said that if we are today saying that Omicron is a mild variant, we need to use it more anecdotally than as an evidence-based reassurance. Because at a critical tipping point, how will Omicron behave is something very difficult right now to decipher. But till that time, it's very, very important not to kind of play the thing lightly. Earlier, WHO takes about a couple of months to call something variant of concern. It puts it under variant under investigation, variant of interest, and then VOC. On 26 November, within a span of couple of days, WHO has called this a variant of concern because of significant number of mutations in spike protein. So there is a time for us to revisit the debate and discussion on the vaccine, and more importantly, because the vaccines that have all been created are created using the first formula of the D614G viral strain.
Right.
So naturally, with the changing landscape of the vaccine, we need to be more prepared now.